So in the next 25 years, I envision NICE to continue to be a beacon of innovation, shaping healthcare as a trusted guide, and to be steering healthcare towards excellence, equity, and most importantly, compassion. And I think how that's going to be done is through a holistic health approach. So the integration of physical, mental, and social aspects of health.
NICE has a number of challenges and opportunities over the next several years and indeed decades. I mean, the most obvious one is a technical one, that new classes of medicines, new approaches to therapies and devices are happening the whole time, and they have to keep up and going into new areas and indeed retreating from ones which have become outmoded. There's also always a need to maintain public support for the NICE approach, which I entirely support, of trying to ensure that the things that are most cost effective are the things that we do with the budget that the NHS and the wider health service has.
Also, in the next 25 years, we'd like to see much more prevalence of the use of real-world evidence in making guidance decisions, particularly for health technologies where the traditional randomized controlled trial data may not be possible. The real-world evidence framework that NICE has developed is a really positive resource that helps innovators understand what evidence they ought to be gathering.
So the challenge that NICE has for modern day clinical practice is how do we rapidly assimilate evidence and adapt that evidence for practice as new knowledge and new information comes in? And how do we adapt the approach so that for a broader group of patients who may have a degree of complexities that we need to involve in our decision making, how can we make sure that the guidance is applicable to them, or is in a format that we can translate it to individual patients with their complexities?
Really showed that NICE was having a major contribution to reducing health inequalities that we can only hope in 25 years' time are much, much reduced, and that NICE has made a contribution to that.
Over the next 25 years, NICE really needs to carry on doing much the same. That's going to be very difficult as new treatments come on board and existing treatments change, but it's really important for clinicians that we have evidence-based guidance informed by appropriate expertise.